Hi, everyone. I'm Lauren Smoller. I'm the Director of Programs at the National Eating Disorders Association. And today I'd like to talk to you about eating disorders and co-occurring mental health conditions. So eating disorders so I just want to give a little bit of an overview first. Eating disorders can affect we're going to review eating disorder types, warning signs, and health consequences. We're going to recognize some common co-occurring conditions. And I'd like to give an overview to treating eating disorders and co-occurring conditions. I just want to make sure that you guys can see the whole screen. So warning signs, symptoms, and health consequences. What are eating disorders? We know that eating disorders are real, life-threatening illnesses with potentially fatal consequences. Eating disorders involve extreme emotions, attitudes, and behaviors surrounding weight, food, and size, caused by a range of biological, psychological, and sociocultural factors. Eating disorders can affect everyone. There are people of all genders, ages, races, religions, ethnicities, and sexual orientations that can be affected. There is a common misconception that eating disorders affects only young white women, and we know that's not true. We know that eating disorders really can affect men. They can affect people with different religions and different backgrounds. We know that as many as 20 million females and 10 million men will struggle with an eating disorder at some point in their lives in the United States. And we know there are high rates of co-occurring conditions, including anxiety, obsessive compulsive disorder, depression, and substance use. Eating disorders are biopsychosocial disorders. There's a host of different factors that can contribute to an increased risk of an eating disorder. These are just a few that I've listed here on the screen. We know that there are multiple causes. We also know that not one of these things is going to be a direct cause of the eating disorder. And eating disorders are a lot more than just food. They're often very complex. They're very multifaceted. They're not simply about weight. They're not choices. These are really complex mental health issues. So some common warning signs are listed here on the screen, but I actually have a really nice video that I think also talks a little bit more about this, but just a really quick overview about some of the different warning signs. There can be signs of weight loss, food rituals, social withdrawal, frequent dieting or body checks, extreme mood swings, a lot of weight fluctuations, could be in either direction, up or down, gastrointestinal issues, dizziness when standing, difficulty concentrating or sleeping, and there can be a lot of issues with dental, skin, hair, and nail health depending on the different symptoms.
Recovery is real. Help is available.
Although there are recognizable warning signs, what you're really looking for is change. Change in attitudes or behaviors related to food, size, weight, really about your self-perception.
Withdrawal from usual social activities, including avoiding eating with others.
Food rituals, such as cutting food into very small pieces or chewing each bite an unusually large number of times, or eating very slowly.
Frequent checking in the mirror for perceived flaws, obsessing over shape and weight.
Negative or distorted self-image or self-esteem tied to appearance.
Hoarding and hiding food.
Eating in secret.
Excessive exercising, and exercising even when you're ill or injured.
Disappearing after eating, often to the bathroom.
Extreme interest in fad diets known as clean eating, or cutting out entire food groups. For example, vegetarianism, veganism, no sugar, no carbs, no dairy.
Changes in personality, such as mood swings, irritability, depression, or lack of emotion.
With binge eating, you're going to find large amounts of food disappearing in short periods of time. People are going to be hiding these containers and these wrappers underneath their bed or in couch cushions out of shame and guilt about what they've been doing.
One of the things that happens when someone struggles with an eating disorder is that their whole GI system tends to slow down. Things like constipation, acid reflux, things like that. Most of these have to do purely and simply with malnutrition and restricted eating. This is an additional level of struggle and distress that it's really hard to help people navigate.
Today, I can say that I'm fully recovered from my eating disorder. Don't ignore the problem. Eating disorders are serious, life-threatening illnesses, and the sooner someone gets help, the better their chances are at full recovery.
Okay, so I also want to just continue on to the 9 truths about eating disorders. This is something that the eating disorder field.
Anorexia nervosa, which is
I'm
often
sorry.
called anorexia, is a disorder that's characterized by very low weight.
So these are 9 truths that the eating disorder field has agreed upon that they want the public to know about eating disorders. Number 1, many people with eating disorders look healthy, however, they may be extremely ill. So you really can't tell how sick somebody is just by looking at them. People with a variety of different weights may be struggling with really severe life-threatening illnesses. Number 2, families are not to blame, and they can be the patient and provider's best allies in treatment. We know that families have sometimes gotten a bad rap in the past, and we actually know that they can be really helpful with recovery and with somebody's support system, helping them to be successful in recovery. An eating disorder diagnosis is a health crisis that disrupts personal and family functioning. This not only affects the person, but it affects their ability to interact with other people. It gets in the way of them living their daily lives. It's really significant. Number 4, eating disorders are not choices, but serious biologically influenced illnesses. So we know that eating disorders have a lot of behaviors associated with them, which are the way that we identify an eating disorder, but these are not behaviors that people are engaging in by choice. These are really serious illnesses. They really need professional help. Number 5, eating disorders affect people of all genders, ages, races, ethnicities, body shapes and weight, sexual orientations, and socioeconomic statuses. This can affect people across all different backgrounds, and it's really important that treatment professionals are able to recognize those different symptoms in people with a variety of backgrounds, so that they can get early intervention and early access to care. Number 6, eating disorders carry an increased risk for both suicide and medical complications. We know that suicidality is a high risk for somebody with an eating disorder, and there are a lot of medical complications that can happen as a result of different harmful behaviors that people with eating disorders often engage in that can have a lot of serious complications, both short-term and long-term. Number 7, genes and environment play important roles in the development of eating disorders, and then that actually goes directly to number 8. However, genes alone do not predict who will develop an eating disorder. So there are genes and environmental factors that play roles in somebody's increased risk of an eating disorder. However, they're not able to accurately predict who will definitely get an eating disorder. And then finally, number 9, full recovery from an eating disorder is possible. Early detection and intervention are important. So we know that recovery is possible from an eating disorder, and we also know that the earlier that somebody is able to access care, the better their outcomes. So today I just want to identify 5 of the more common eating disorder types. These are anorexia nervosa, bulimia nervosa, binge eating disorder, avoidant restrictive food intake disorder, or ARFID, and other specified feeding or eating disorders, or OSFID. The term in eating disorders can include a lot of extreme emotions, attitudes, and behaviors surrounding weight, food, and size. It's important to know that eating disorders are rooted in uniquely low self-esteem and disruption in somebody's relationship with themselves. They're extremely serious. They're life-threatening. They really all should be taken very, very seriously. This list is not going to be exhaustive of all of the different types of eating disorders. I'll touch a little bit on that later as well. But the NEDA website is actually a really good resource for learning a little bit more about all of these, as well as learning more about other eating disorders. So anorexia nervosa is characterized by self-starvation and excessive weight loss. The symptoms include inadequate food intake, leading to a weight that's very low, disturbance in the experience of body weight or shape, so they're not able to identify just how low their weight may be. They can't really see how they look themselves. That's part of the mental health issue. There's an intense fear of weight gain, obsession with weight, and persistent behavior to prevent weight gain. And they're also really unable to appreciate the severity of the situation. So this means that somebody that's struggling with this eating disorder often does not realize how severe their symptoms are, how life-threatening their disorder is, and how in need of help they are. Some warning signs of anorexia nervosa are dramatic weight loss, preoccupation with weight, as I mentioned before. And then some health consequences: dry hair and hair loss from malnutrition, fainting, and fatigue are very common. Muscle loss, overall weakness. They can have an abnormally low heart rate, low blood pressure, and ultimately a risk of heart failure. Severe dehydration, which can result in kidney failure, and osteopenia or osteoporosis. Bulimia nervosa is characterized by binge eating and compensatory behaviors, such as vomiting. There can also be laxative abuse and excessive exercise. This is all in an attempt to undo the effects of binge eating. So symptoms include frequent episodes of large amounts of food, followed by some kind of compensatory measure designed to prevent weight gain. The feeling of binge eating is often a really out of control experience. This isn't something that they're doing deliberately. They're consuming large amounts of food past the point of comfort. They often have an extreme concern with body weight and shape. And most people with bulimia nervosa are of a normal weight. It's very hard to tell if somebody is struggling with this disorder in particular, because they can struggle at any weight, any size, they often appear to be healthy and they're really struggling with something very serious. So some warning signs of bulimia nervosa can be frequent trips to the bathroom after meals. They may have a very rigid exercise routine, a very compulsive need to burn calories off. As a result of some of the vomiting, they may have discoloration of staining of the teeth. They often have withdrawal from friends and activities. Often they will also continue to exercise past being injured. So they may have injured themselves and continue to exercise. They may have a doctor recommend that they take time off from exercise and continue to do so anyways. And sometimes they will have calluses on the back of their hands and knuckles from self-induced vomiting. Some of the health consequences for bulimia nervosa, it can affect the entire digestive system, leading to electrolyte and chemical imbalances that can really affect a host of different organs, including the heart. It can affect irregular heartbeat, heart failure, ultimately death. There are imbalances that can cause dehydration, that are caused, by dehydration, loss of potassium, sodium, and chloride as a result of purging. And they also can have a variety of additional health consequences as a result of some of their behaviors. Gastric rupture during periods of binge eating, inflammation and rupture of the esophagus, which can be extremely dangerous, tooth decay, as well as chronic irregular bowel movements and constipation as a result of laxative abuse. Binge eating disorder is characterized by recurrent binge eating. However, it's without the regular use of compensatory measures to counter the binge eating. Symptoms are this out of control binge eating component similar to bulimia nervosa. Often they're eating when they're not hungry. They're eating to the point of discomfort, and they may be eating alone. There's a lot of shame and a lot of guilt regarding the binge eating. Binge eating disorder is actually the most common eating disorder in the United States. It's often misunderstood as simply overeating, but as mentioned, this isn't something that they're doing intentionally. It's a really out of control feeling. It's past the point of comfort. There's often a lot of guilt. It's not a choice. There's a huge psychological impact on this person who's struggling. Somebody with binge eating disorder can actually be any weight or size as well. You really can't tell if somebody's struggling from binge eating disorder based on their size. We know that some of the health consequences or health issues that can result from binge eating often are similar to issues with obesity. However, they can really struggle at any size. And we know that people of any size can be a variety of different places in their health. And somebody of a larger body may not necessarily be struggling with any health issues. I would be careful to not assume that anyone in a higher weight body is really struggling with binge eating disorder. We know that people of a variety of different weights will struggle. So warning signs of binge eating disorder, a lot of secretive eating habits and binging episodes. There may be signs of the binging episodes. You may find large amounts of food in the trash or wrappers, or food hidden away as a result of binging. A large amount of food may be spent, a large amount of money may be spent on food. Those are some of the different signs. And then health consequences, musculoskeletal problems can result, gallbladder disease can result, high blood pressure, high cholesterol, heart disease, as well as type 2 diabetes. Avoidant restrictive food intake disorder is a little bit different. It's characterized by a lack of interest in food, and there's a large fear of negative consequences of eating. A lot of times this looks like picky eating. It may be picky eating as it was displayed earlier in somebody's childhood that they were not able to overcome. They have a consistent reduction of food intake and often have frequent complaints of body discomfort with no apparent cause. And it's also this lack of interest with food, with the preferred foods or the foods that they're okay with eating narrowing over time. So there's a lot of food restriction, but from a very different perspective. Some of the health consequences can result failure to thrive because of, so they may not meet their expected growth expectations. They may struggle with anemia, they may have weight loss, gallbladder disease, malnutrition, which can result in dry hair, hair loss, brittle bones. They may have difficulty concentrating, and they can also struggle with osteoporosis or osteopenia. Other specified feeding or eating disorders is another eating disorder category that is very serious. However, often it's criteria where people are struggling from a very serious, potentially life-threatening disorder. However, they're not meeting the exact criteria for some of these other ones that we just talked about. So these are a few examples here of who may be diagnosed with other specified feeding or eating disorders, or OSFED. Atypical anorexia nervosa means that this person is struggling, they're restricting, but they may not meet the weight criteria that is required for the diagnostic criteria for anorexia nervosa. That doesn't mean that their eating disorder is any less severe. It can be just as life-threatening, but they may just not meet that exact criteria, and therefore they would get the OSFED diagnosis. Subthreshold bulimia nervosa is similar to the criteria for bulimia. They may have the same behaviors with this binge eating and purging component, but there's a certain amount of occurrences to meet the requirements for diagnostic criteria for bulimia nervosa. And if they don't have that exact frequency, then they would be given an OSFED diagnosis. Similar for binge eating disorder. And then purging disorder and night eating syndrome are a couple of other examples. This is not an exhaustive list. There's a host of different combinations of behaviors that are very severe and very in need of treatment, but may get the OSFED diagnosis. So some health consequences of eating disorders, generally, there are cardiovascular issues. There can be muscle loss due to calorie restriction, a lot of risk of heart failure as the blood pressure and heart rate drop. Something to note for this is for athletes, there's already, typically for athletes, they have a lower heart rate. So it can be really difficult if an athlete is struggling to diagnose this and for this to be an identifying symptom. But for somebody who's not typically going to have a lower heart rate, this is a warning sign. Electrolyte imbalance can also lead to this irregular heartbeat and heart failure. For gastrointestinal issues, there can be gastroparesis. There can be an interfering with like the normal stomach functioning as a result of food restriction or vomiting or purging in different ways. This can result in stomach pain and bloating, nausea, vomiting, constipation, blood sugar fluctuations, blocked intestines, a whole host of different things. Constipation can also result from a variety of the different behaviors, the malnutrition, the laxative abuse often can even lead to a dependency on laxatives because of the consistency of use. Binge eating can cause the stomach to rupture, which can create a life-threatening emergency. Vomiting can also wear down the esophagus, causing that to rupture. Vomiting can also cause sore throats and a hoarse voice. When somebody vomits over a long time, they can actually also have their salivary glands can get swollen, so their ears and their jaw may look swollen. This can also happen when they stop vomiting. And malnutrition and purging can also cause pancreatitis. For neurological symptoms, the brain needs about 1/5 of the body's calories in order to function, which means that not getting the amount of nutrients needed from a variety of different behaviors can lead to obsessions of food, difficulty concentrating, difficulty sleeping. The body's neurons also need insulating with the protective layer of lipids, and this is necessary to conduct electricity. So if they're not getting the nutrients that they need for or inadequate fat intake, for example, this may cause numbness and tingling in hands and feet and other extremities. Severe dehydration and electrolyte imbalances can also lead to seizures and muscle cramps. Fainting and dizziness can happen as well if the brain and blood vessels aren't getting enough blood to the brain from not enough nutrients. And there can also be an increased rate of sleep apnea for people in higher weight bodies as a result. For the endocrine system, there can be a lot of hormonal changes. So we know that fat and cholesterol are really necessary for that function. So there can be a reduction in sex hormones, particularly estrogen and testosterone, as well as thyroid hormones. Lowered sex hormones can also cause menstruation issues. So that may result in infrequent or the absence of period of menstruation. And this means that, that's often a sign of malnutrition and concern for women. The lowered sex hormones can also increase bone loss. So again, osteoporosis, osteopenia. Binge eating can also increase the chances that somebody's body will become resistant to insulin, increasing the likelihood of type 2 diabetes. Without enough fuel, the body temperature can also drop, and that can result in hypothermia. And then there can also be this growth of lanugo. This is like fine hair that grows on the body during periods of extreme starvation to keep the body warm. Kidney failure can also happen as a result of dehydration. Anemia can also occur, and as well as there can also be a low blood cell count as a result of malnutrition, which can lead to issues with fighting infections. So we know that eating disorders are very serious. They're potentially fatal. We've had research that has confirmed this. A review of nearly 50 years of research confirms that anorexia nervosa has the highest mortality rate of any psychiatric disorder. We know that there's an increased risk of suicide or medical complications for eating disorders, and there has been a study that found that bulimia nervosa and eating disorders not otherwise specified, which was what OSFED was before the DSM-5 was published. We found that there's an elevated mortality risk that's very similar to those with anorexia nervosa. So for co-occurring conditions, we know that there's an increase in the prevalence of co-occurring conditions for people who are struggling with eating disorders. This also really affects the ability of symptoms to present. It can be really difficult to diagnose somebody who's struggling with other mental health issues, to also identify those that might be eating disorder symptoms. And it can also intensify eating disorder symptoms. This can also impact treatment, can really affect somebody's ability to recover, to understand what level of care they really might need. It can also get in the way of their ability to connect with people and stay consistent with the care that they might need. And it really requires planning and a team approach. So this is a lot of collaboration required from different professionals who understand the different disorders and can speak to the different needs of treating different disorders to be able to be successful for an individual who's struggling. So these are just a few of the comorbidities that are common: depression, anxiety, obsessive compulsive disorder, alcohol and substance abuse, self-harming behaviors, bipolar disorder, borderline personality disorder, and post-traumatic stress disorder. These are just a few of the ones that are very common with eating disorders. We know that there's this high prevalence rate in a nationally representative survey of respondents with eating disorders. 95% of individuals who had bulimia nervosa also met criteria for one or more co-occurring disorders. 79% of people with binge eating disorder and 56% of people who had anorexia nervosa had one or more co-occurring disorders. For anxiety, depression, and PTSD, these are prevalence rates. So some of the ranges are from various studies, but we can see kind of the range here. 32 to 51% of people struggling with anorexia also have co-occurrence of anxiety or depression, 12% with post-traumatic stress disorder. Bulimia nervosa is actually 36 to 81%, depending on the study of anorexia, who struggle with anxiety or depression, and 45% with post-traumatic stress disorder. And then 32 to 65% are struggling with anxiety and depression who also struggle with binge eating disorder, and 26% are struggling with post-traumatic stress disorder. These are some more common types of anxiety disorders that people with eating disorders struggle with, so social anxiety being one of the most common ones, and here are some prevalence rates of people who are struggling with the anxiety disorders as well. We know that individuals with anorexia or bulimia are more often than not going to have a primary anxiety disorder. And 2/3 of people with anorexia showed signs of an anxiety disorder several years before the start of their eating disorder. So there's a large amount of co-occurrence here. For eating disorders and obsessive compulsive disorder, there's a markedly elevated risk for obsessive compulsive disorder. 69% of patients with anorexia nervosa and 33% of patients with bulimia nervosa also had a coexisting diagnosis of OCD. We can see that there's a lot of overlap with some of the behaviors that are very typical with somebody struggling with an eating disorder that may also occur with somebody struggling with obsessive compulsive disorder. This obsessive thinking about food and weight and eating, food rituals, compulsive checking of food labels. These are all very common behaviors for somebody who's struggling with an eating disorder that you can see would also go along with an obsessive compulsive diagnosis. For eating disorders and depression, there's also some co-occurrence with major depressive disorder. 32 to 39% of anorexia nervosa, of people struggling with anorexia nervosa, also have major depressive disorder. 36 to 50% of people with bulimia nervosa, and 33% of people with binge eating disorder. In anorexia, we know that depression can disappear after weight restoration, and body dissatisfaction can actually increase the risk of depression. So there's a lot of interrelated factors here. For substance abuse, up to 50% of individuals with an eating disorder abuse alcohol or illicit drugs. This is 5 times higher than the general population. So these are numbers of people who have struggled with alcohol use or dependency who are also struggling with an eating disorder. So 25% of individuals with anorexia nervosa struggle with alcohol use or dependency, 34% with bulimia nervosa, and 21% with binge eating disorder. For any substance use disorder, the numbers are a little bit higher as well, 27% with anorexia nervosa, 37% with bulimia nervosa, and 23% with binge eating disorder. Some of the more frequently used substances for individuals struggling with eating disorders can be caffeine, tobacco, alcohol, laxative abuse, a lot of times diuretics, that sort of thing, appetite suppressants, sometimes heroin and cocaine as well. These substances are often used as appetite suppressants or ways to purge. For eating disorders and borderline personality disorder, there's a lot of these also behaviors that can overlap. We find that they're more common in people who are struggling with bulimia nervosa, impulsive behavior with substance abuse, sexual promiscuity, and shoplifting, self-harming behaviors, feelings of depression, emptiness, and intense relationships are often seen with people who are struggling with eating disorders. There's a large overlap with people who are struggling with eating disorders and self-harm as well. These are just some of the symptoms that somebody struggling with self-harm and struggling with an eating disorder may struggle with. This is distinct from suicidality. These people are not always suicidal. There is sometimes a link to trauma, and these rates are also higher for people who purge. We find that also people with self-harm and eating disorders find that there's a struggle with when they're recovering from one, if they're not treating both of them together, that one may come back as they're treating the other one. So this really highlights the need of individuals who are struggling with co-occurring issues to be able to be treated with professionals that can understand those issues together and treat them at the same time. So these are just some of the more common comorbidities, just to review: mood disorders, anxiety disorders, and substance abuse. And again, just want to highlight that it's really important to address the conditions, the co-occurring conditions as well with the eating disorder treatment. So for seeking treatment, there's intervention, professional treatment, ongoing support, and recovery. We know that early diagnosis and intervention can significantly enhance recovery. Following the intervention, professional treatment should be the first step. Connecting with a professional that specializes in eating disorders and any co-occurring conditions is important. And then ongoing support from friends and family is so important to the success for recovery. And then just want to highlight that recovery is not linear. We know that people are not going in a straight upward movement with recovery. There's a lot of challenges along the way, so there can be a lot of ups and downs and back and forths. It's something that we understand can go through phases and challenges. So for individualized care, the treatment process has a lot of steps. Initially, there's the initial assessment and diagnosis by a medical professional. Determining the level of care is important, and also the different treatment modalities that might be necessary. And then the next step would be to interview providers, find who's going to be best for that person based on the level of care that they need, what different providers they may need. If they're in outpatient care in particular, there may be a whole team of people who may be necessary. Often that's a therapist, a nutritionist, a medical doctor, sometimes a psychiatrist that work as a team together to treat the different issues related to the eating disorder and the co-occurrence. And then communication with everyone involved, making sure that talking to your insurance provider, if that's a factor, and understanding the full coverage, engaging the support team that you have, not only your treatment professionals, but your friends and family as well. And then a maintenance plan is really important. If you're going from one level of care to another, having a plan to be able to step down, to be able to get ongoing support as you continue to maintain your recovery. So for eating disorders, there are typically these 5 different levels of care. We've listed them from most to least intensive. So inpatient care is usually when somebody's not medically stabilized, they're in a hospital setting, they have compromised vitals. And then if they're medically stable, they can be in a residential facility if they need 24-hour care still, but they don't need a hospital setting. This is a very rigorous program, usually with a lot of support for 24 hours. And if they are in a lower level of care, they may be in partial hospitalization, which is not overnight, but still very intensive. Generally, it's an all-day program that they are attending. So they're still having meal support, which they would have in residential and inpatient as well. They're receiving a lot of attention from their treatment providers over the course of the day. And then intensive outpatient may be a little bit less with that. They may go a couple of times a week, or they may have a half-day program, something like that they're able to attend. Still, again, getting a lot of support from their treatment providers, but less frequent. And this often people will start at a higher level of care and move down as they're becoming more able to manage their symptoms. And then finally, there's outpatient care, which can be 1 to 2 or so times a week with their treatment providers and meeting with their different team members to receive their care. And then as they become more successful in recovery and they're better able to handle that, they may also reduce those visits as well. So different support and resource options for people with eating disorders. One thing that is really fantastic that we have on our website is our eating disorder screening tool. So this is something that we launched last year in February, and we found that 96% of participants scored at risk for an eating disorder in the first 6 months. In the last year, we've had 160,000 people take the screening. And it's really quick access to help. So once they're done, they're able to go through this screening tool. You can see here, there's an example of the question that's involved with it, that they answer a host of different questions that identify. And then at the end of the screening tool, it will say whether or not you're at risk for an eating disorder and give options to be able to connect with care. Something else that's really helpful for different people who are supporting individuals who may be struggling with an eating disorder are our toolkits. We have an educator's toolkit for people who are in a teaching role or in an educator setting who may be supporting students who are struggling with eating disorders and being able to understand how in their role they're able to support somebody who's struggling. The parent toolkit is a great resource as well for parents as well as family members or loved ones who are helping someone who's struggling with an eating disorder. It gives a huge amount of information. It gives terms, it gives the way to pursue treatment and different things to consider when accessing care to be able to help navigate that whole system. And then the coach and athletic trainer toolkit is available for coaches and trainers who are supporting individuals who may be athletes struggling with eating disorders. There's some particular needs that an athlete may have that are slightly different than another person who may be struggling with an eating disorder, and this really helps to guide people in those positions who can help support their athletes who are struggling. In terms of how to help, there's a lot of things that you can do and a lot of things that we recommend you don't do. So in terms of doing, learn as much as you can about eating disorders. Be really honest and vocal about your concerns to somebody when they're struggling. Be really caring and firm. So you want to be really honest and vocal about your concerns and also be really firm about the fact that that you're suggesting that they seek professional help from somebody who really specializes in eating disorders and can give them the help that they need. And something else that's a really good thing to do is to be a good role model. Practice good, healthy habits and attitudes around food and weight and things like that, that really will support somebody who's struggling or at risk for an eating disorder. We really recommend you don't place shame, blame, or guilt on somebody who's struggling with an eating disorder. We know this isn't something that they've chosen to do. We recommend you don't make rules or promises that you can't or won't uphold for somebody just in terms of trying to get them help. Don't give simple solutions. This is a super complex illness, and there's not a whole lot of simple solutions to getting the help they need. It's really important that they get help from treatment providers who specialize. It's really important to not invalidate their experience or try and convince them to get over it or anything like that. We really want to make sure that we're listening and accepting what they're going through. We don't recommend giving advice about weight, exercise, or appearance. This is a really touchy subject for somebody that's struggling with an eating disorder. How they perceive those messages can be very complex and very challenging and potentially life-threatening for them as well. And it can be really difficult to give advice about this kind of thing if you're not a treatment professional that specializes in eating disorders, especially knowing that recommendations for somebody who's in recovery for an eating disorder may look very different for somebody who's in a healthy place. We also don't recommend ignoring or avoiding the situation until it's more severe. It's really crucial to get help as soon as you can. This is another video about how to help a loved one that I'm just going to go ahead and play as well.
Recovery is real. Help is available.
People often notice that a loved one or a friend is changing their eating behaviors or their attitudes toward the food, towards weight, towards their size, towards themselves. It's really important to express your concerns about this in a loving and caring, supportive way. But also it's important not to wait too long, because the longer an individual is walking into the path of the eating disorder, the more physical and emotional consequences they'll need to face.
Learn about eating disorders so you will recognize the signs when you see them and know the difference between myths and facts.
Set aside some time to have a private conversation with your loved one and voice your concerns in a way that's honest and sympathetic.
Remind your friend and your loved one that you care about them and you just want them to be healthy and happy.
Be prepared for a difficult conversation. Someone who's struggling with an eating disorder is already scared, and it's extremely difficult for them to hear this kind of conversation. So when you do it with love and attention to their needs, not yours.
Share your own difficult experiences and painful emotions.
It can be really important for them to know that they're not alone and that there's nothing wrong with them for struggling.
Don't give advice about weight loss, exercise, or appearance.
Avoid placing shame, blame, or guilt on your friend regarding their actions or attitudes.
Don't oversimplify. Avoid saying things such as, if you just started to accept yourself, everything would be all right. Or if you just started eating normally, everything would be fine.
Use I statements. For example, I'm concerned because you don't eat breakfast or lunch, or it makes me afraid to hear you vomit.
Set boundaries to preserve your own emotional well-being.
It's important to suggest that they seek professional help from a physician, a dietitian, a therapist, someone who understands eating disorders.
One of the most important things you can do is educate yourself about eating disorders. Dig into the facts. Go to the NEDA website. There continue to be lots of myths and misconceptions about these disorders, and you need to educate yourself about what's true.
I know I'm not the only one that struggles with body image and eating disorders.
My life in recovery is more beautiful than I ever thought possible, but I had to make that commitment to myself.
Okay. So next, with talking about eating disorders, these are just a few things to keep in mind. We really don't want to emphasize numbers or tips when we're talking about eating disorders. We don't want to say he took X amount of laxatives a day, they lost X amount of weight. That's not something that's going to be helpful for somebody that's struggling. We really want to watch out for the appearance ideal. This is the kind of cultural ideal that we have in society. A lot of times people identify it as a thin ideal. It varies across different cultures, but we want to make sure that we're not emphasizing that and that we're really making sure that we're understanding that there's healthy sizes at a variety of different body types. We want to make sure that we're not glamorizing eating disorders, that we're not making them sound like a positive struggle. They're really serious. They're really life-threatening. We don't want to portray them as hopeless either. We know that recovery is possible, and we know that eating disorders are very serious, but you can recover. And then we also really want to make sure that we're not focusing on images or descriptions of the body that's at its unhealthiest point. This can be very triggering for somebody who's actively struggling with an eating disorder. It's one of the similar things to the tips and numbers thing. We want to just kind of avoid highlighting those sensitive issues. Another thing that I'd love to talk about is one of the prevention programs that the National Eating Disorders Association has available. The Body Project is a train the trainer model. It's an early intervention program that we have for high school girls who are able to confront the unrealistic body ideals, beauty ideals, and they're able to develop a healthy body image. We've trained over 300 people in 27 states so far. And this Body Project has over 2 decades of research that has been shown repeatedly to effectively reduce the body dissatisfaction, negative mood, unhealthy dieting, and disordered eating. This is just a quote that kind of shows just how effective the program has been. Now that I've done the Body Project, I've noticed that I see my body more positively now and I stay away from negative comments. I'm also doing this with my family members and staff around me. And then something else that I want to mention is our national helpline. We have our information and treatment options helpline, which is open from 9 to 9. It's a little bit, the times are switched, but it's actually 9 to 9 Monday through Thursday Eastern time and Friday 9 to 5. There's 24/7 crisis support also available if you text NEDA to 741-741. In 2017, we've had over 1,500 contacts who report a co-occurring condition who have contacted our helpline. And 1 in 5 are reporting barriers like fear of reaching out or barriers to accessing help. And that's really what the helpline is here to help with, is to talk to people about what options are available for them and connect them with treatment options. In particular, for people who are struggling with a co-occurring condition, the helpline is available for people who are looking for a treatment provider that specializes in both issues. And I think the only other thing that I just want to mention briefly is we are having our National Eating Disorders Awareness Week coming up at the end of February. You can access it at nationaleatingdisorders.org/NEDA awareness to get involved. And this year our theme is Let's Get Real. We're really excited to get engaged with other communities and really get them involved with eating issues and body acceptance and understanding that struggles can happen in a variety of different ways. And I think I'll hand it back over.
Thank you so much, Lauren, for your excellent presentation. It has generated a lot of interest. We're now going to start to answer the questions that were submitted during your presentation. And everybody, you can still submit questions for Laurel. I think one question that has come up is really different resources that are available for the clinicians, for family, and for educators. You were just mentioning the helpline, and namely the treatment providers. Could you expand a little bit more on that, please?
Sure. We have an online treatment provider database which has access to treatment providers all over the country, different levels of care that people can actually access on our website. And they can also access it by contacting the helpline if they would like a little bit more help with it. And you can actually narrow down your search based on location as well as other issues that you may need a specialist for. And that's a really good resource to be able to access if you're looking for a treatment provider that specializes in eating disorders as well as a co-occurring condition. And our helpline is available as well as an additional support. Sometimes people have a difficult time navigating, or they're so overwhelmed if they're struggling with an eating disorder, they really just need somebody to talk to validate concerns, to be able to explain to them a little bit more about what their options are and what their next steps might be. And the helpline is a really great resource for that. We often say that it's a really good first step for people who don't really know where to turn or who even to access for care.
Thank you so much, Lauren. I see there's another question on the body project you just mentioned and how successfully you've been using this at NEDA. Now, do you have some type of training like this or some type of plan that clinicians could incorporate into their treatment plan with patients?
Yeah, that's an interesting question. So the Body Project is an early intervention program. So it's actually before somebody's actively struggling with eating disorders. It's one of the reasons we're so passionate about it, is because it's a program that is designed and has evidence to actually reduce the risk of eating disorders before somebody gets it. So if somebody's actively struggling with an eating disorder, we want them to access help from a treatment professional. But these exercises and the training involved with this program are really for the at-risk high school girls before they are diagnosed with a full-blown eating disorder. It's actually designed while they already have those confusing messages and behaviors that are around them in the culture to be able to reduce that risk of them actually getting an eating disorder.
Thank you so much. I see there's another question that has to do with families. What type of support can NEDA provide to families when they have a loved one struggling with an eating disorder?
We have a lot of options. One of the things to start with is our helpline. It's a resource not only for individuals, but a lot of times it's a resource for family members who really don't know what to do. They're looking for more information about eating disorders because either they just found out that their loved one is struggling or they're not sure. There's our parent toolkit is a really great resource for kind of all loved ones who are trying to better understand eating disorders and what to do and how to support a loved one who's struggling. We also have we're actually having a regional conference coming up in May in Philadelphia that will be at Drexel University on May 12th. That's supposed to be a resource not only for individuals, but for family members to come and to learn about eating disorders. ways to support somebody with an eating disorder, ways to support themselves as they support somebody with an eating disorder. And then another really great community resource that we have is our national walks, where people often come all together to learn more and engage with other people and other families who are supporting their loved ones who are pursuing recovery from an eating disorder.
Thank you very much. You were also talking about in treatment, about the different phrases, and then recovery and the different settings. And what is the experience of NEDA with recovery for the different disorders? Typically, how successful is a recovery? How long would it take on average?
Yeah, that's such a challenging question because it's such an individual thing. So, you know, recovery can be so different for different people, and even what recovery looks like can be a little bit different for different people. What we really stress is that ultimately we want to connect somebody with professional help, with somebody that specializes in eating disorders, so that they can really assess that person's needs, their behaviors, and help them move forward in the direction of recovery. But a lot of that is going to depend on how long they've been struggling, the severity of their symptoms, the support network that they have. There's a whole host of different factors. It really is going to look different for different people.
Thank you so much. Yes, that makes a lot of sense. I think here, just a last question is, does NEDA provide any peer support groups? Is this something that exists?
We don't ourselves, but we do have something on our treatment provider listings. We have a support group listing of people who actually list free support groups all over the country for eating disorders that people can search for in their state and find different options in their area. And then another resource that's not quite a support group, but another supportive tool for families and for individuals is our online forums that we have, which are 24/7. They're monitored by trained volunteers to be able to create a safe environment for people, but really talk and connect with other people who are actively struggling or actively supporting loved ones with eating disorders.
Thank you very much, Lauren, for your presentation. And thank you to the participants for attending today's webinar. You will be receiving a follow-up email in about 48 hours that includes a link to the evaluation. Please do share your thoughts. If you are not yet an ADA member, please consider becoming one. ADA offers an excellent members benefits package such as year-long access to continuing education, free access to special interest groups, including peer online consultation groups, significant discount to ADA's annual 4-day conference, promotion of your practice in ADA's online Find a Therapist database, and much more. We hope you'll join us at the Anxiety and Depression Conference in early April, or April 5th to 8th in Washington, D.C. And on behalf of ADA and our presenters, thank you so much for joining us today, and thank you to our presenter, and all have a great rest of your day.